Okay, I think we'll make a start. Welcome everybody to the Royal College of Pathologists Black History Month event. This year, we're discussing how pathology can reduce health inequalities. A few housekeeping items first. We will be recording the event, and this should be available for you to view at a later date, hopefully. The audience will be on mute and the video switched off to just help the tech side of things go smoothly. We'll start with some general introductions and we'll follow this with a conversation between myself, Dr. Subarna Chakravorty, who's a consultant hematologist, and our guest, Professor Dame Elizabeth Anionwu. There will be a question and answer session after this. Please enter your questions as they come to you in the Q&A box, and we'll go through as many of those as possible this evening. So for some general background before introducing our fantastic guest, the pandemic gave me, and I'm sure a lot of you, time to reflect on quite a lot of things. COVID-19 shone a bright light on health inequalities, racial disparities, poverty. As people have said, we're all in the same storm, but we certainly didn't all have equally seaworthy boats. In October 2020, the Royal College of Pathologists became a founder member of the Inequalities in Health Alliance with a number of other Royal Colleges. This was launched to press the government for urgent action to address health inequalities. As part of this wider process, the Royal College of Pathologists also recognised that its own representation at senior levels certainly didn't match the diversity of its members. So the diversity network was set up, and this is really to enable more people from all backgrounds to become involved in the college, a more diverse representation, hopefully helping us address health inequalities that we've known about for long, but only saw their consequences too tragically during the pandemic. This evening's event's been organised by the Diversity Network, and I'd like at this stage to thank Dr. Esther Yaud, who's a pathologist, for her energy and enthusiasm and commitment in leading this network over the last several months, ensuring that as many voices in the college are heard and listened to. I'm proud this evening to be able to introduce this year's Black History Month guest, and in conversation with Professor Dame Anionwu, to celebrate her career, to share her experiences as a nurse, health visitor, educator, advocate, activist. She established the first nurse-led UK sickle cell and thalassemia screening and counselling centre. That was back in 1979. She holds numerous fellowships and awards in recognition of her work in sickle cell and thalassemia, and is patron of a number of societies and charitable associations. In 2017, she was honoured with a damehood for her services to nursing and the Mary Sickle Statue Appeal. I could list many, many more accolades, but I didn't want to forget a couple. Dua Lipa named Dame Anionwu as her personal Best British Female of the Year on stage at the Brit Awards, further emphasising her wide-ranging influence in British society. Also, her book, Dreams from My Mother, more on which later. Thank you very much, Dame Anionwu, for joining us tonight. Enough from me, and now over to Subarna to start the conversation. Thank you.
Thank you, Samar, and thank you, Dame Elizabeth, who insists to be called Elizabeth. So for the rest of the evening, we will call you Elizabeth. And thank you, Elizabeth, for gracefully agreeing to come and talk to us today. We really look forward to this conversation. We already had a really stimulating backstage discussion, which I'm hoping that we will continue in today's session. Elizabeth and I have met each other at various previous occasions and more recently interacted on Twitter. And of course, my background is in sickle cell and thalassemia work as well. So there's a bit of commonality in the work we do. And I'd probably like to sort of kick off talking about sickle cell and thalassemia work. And more perhaps thinking about sickle cell as well, in the sense that, sickle cell, as a disease has been known for in the Western medicine for over 100 years. And in fact, it's got a lot of firsts, hasn't it? It's been the first molecular disease, as it were, to be identified when the abnormality in the hemoglobin was thought to cause the main, the central pathology of the condition. And yet, although that was identified, many decades ago, here we are in 2021 with not that very many options for treatment for this condition. And we could discuss, and we will discuss at length, why that is. But before we do that, perhaps I'd like to ask Elizabeth to just kind of take us back to a time when you were first sort of starting out in this area of work, and the kind of challenges you faced at the time for both sort of awareness of clinicians, doctors and nurses, awareness of the public about this condition, as well as kind of educating our families and patients themselves about this condition. And then perhaps we can talk a little bit about the present as well, but maybe you could give us a little bit of idea of how it was like in the very beginning of you setting this up. Very pioneering work.
Thank you. Thank you very much indeed, first of all, for the invitation to have this conversation with you all. It's a huge honor. I've been asked this question quite a lot, as you can imagine, because I'm retired. I've kindly alluded to earlier, I've published my memoirs, and it's allowed me to reflect on why I got involved, and I think of this, I've put it under three P's. So it's personal, professional, and political. And it was actually professional that kickstarted it, in the sense that it was when I was a newly qualified health visitor in the early 1970s, working in Brent. And on my caseload were several families who had children with sickle cell disease. And the first family that I ever visited, there was a mother, and the young lad was about 9 with sickle cell anemia. And he had just come out of hospital, and he was on the couch, and he was in some discomfort, but not excruciating discomfort. And what was interesting was that the mother was reasonably happy with the pediatric care that her son was receiving. She had no complaints about that. What she was frustrated with, though, was she didn't feel that she had enough information given to her about this illness, so that as a mother, she could ideally prevent sickle crises, or at least be aware of what was more likely to bring on the crisis. What could she do in the home? Were there any guidelines in terms of his attendance at school? One of the teachers was forcing him to do PE. How could she explain to the teacher that this could actually make her son's condition worse? So it was all these sort of very pragmatic queries that the mother was now asking me. Well, I had never had a lecture on sickle cell disease, either in what was the state registered nursing course in those days at Paddington General Hospital, 65 to 68, just to put it in historic context. Not one lecture on sickle cell anemia. Neither did I get it in the short part of midwifery education that I had, and neither did I get it in health visiting. So if we take the state registered nurse course and the health visiting course, both of those were undertaken in London in the early 70s, or late 60s and early 70s. And I thought, why was it that I wasn't taught about this illness? So I'm a bit of a bookish person, slightly nerdy occasionally. And I had already got an interest in genetic counselling. I don't know why, not necessarily to work in it, but to learn more about it. And a few years later, when I was aware that this was still an issue, that my colleagues and my younger colleagues were still not being taught, there were some places where they were taught, of course, but the vast majority of my colleagues was still not being taught about sickle cell disease in their health visiting or nursing courses. I happened to get hold of a textbook on genetic counselling that was published in the mid-1970s, I'm sure by two eminent geneticists. But you can only imagine the horror when I came across the section on sickle cell disease. What did they say? Well, they said it was a condition that mainly affected the Negro population, but that has little relevance to us in the United Kingdom. A mid-1970s genetic counselling textbook published in this country. You know, I was getting angry, you know, for various reasons as I was growing up, but my goodness, when I read that, and I think that paragraph that I read symbolized to me the, well, actually, it was really quite ridiculous situation that you have these individuals that are geneticists. Come on, they're geneticists. How they know about sickle cell disease, but they can't relate the condition to the country that they're working in. I'm sure there's loads of reasons people could put forward. I didn't care about it. I was an angry health visitor wanting to try and support this family. And I felt so ashamed, frustrated, confused. Why was it that I was not able to provide this basic information that this mother was asking me, which was I saw as part of my role as a health visitor? I could have helped that mother if she had been asking about epilepsy, pneumonia, cystic fibrosis, and I do not put any genetic condition in any sort of hierarchy. However, the reality was that I did know about cystic fibrosis, and I did know about hemophilia, but I didn't know about sickle cell disease. And it just, so I've talked about the professional, but you can see where the political comes in then, and the personal, because I'm mixed race. At the time that I met this first family with an individual with sickle cell disease, that was about 1970, I think it was 71. I then met my father. I know we'll come to that probably later, but I met my Nigerian father in 1972. And then I met my extended Nigerian family that were in London, well, in this country, in fact, and found out that one of my Nigerian cousins, had sickle cell anemia and was living in this country. So that's where I hope that will explain the personal, professional, political, that it was very clear as I reflected, why was I so interested in this condition? However, going back to professional, the other most important trigger, influence, I would say, rather than trigger, was Dr. Misha Boshovic, who was the then consultant hematologist at the Central Middlesex Hospital. And she had arrived there, I think it was 1976. And I was now working, I had an office there as a community nurse tutor. It was Dr. Boshovic, I noticed, was giving a lecture, lunchtime lecture, on sickle cell disease. Wow, you can imagine, I hot-footed it to that lecture, and I was enthralled by the lecture she gave. And I asked a lot of questions. I noticed she was giving another lecture, because it was, I mean, to be fair to professionals, there was a thirst for knowledge about this condition. So I wasn't the only one that had not had information in my professional training. So I went back and I listened to Dr. Boshovic again. And I asked more questions. I left the lecture theatre. I was walking down the long corridor of Central Middlesex Hospital, and I heard this click, 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 hello, hello, click, 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 hello. And I turned around, and it's Dr. Boshovic racing towards me. And to cut a long story short here, I ended up working with Dr. Boshovic, who, as I'm sure many of you know, became an eminent specialist in sickle cell disease. And so she was the person that really was my mentor, my ally, my teacher, who enthused me and encouraged me. And it was when I went to America on holiday, but also to sniff out what the Sickle Cell Disease Association was doing over there, when I discovered that there were these individuals called sickle cell nurse practitioners. Came flying back, literally flying back, and spoke to Misha and said, look, I think I could have a role here. And she got the funding for me to become the first sickle cell nurse counsellor in 1979. So I've said quite a lot there, but I thought if I put it in some historical context with those 3 Ps, hopefully that might explain why I got involved, why I was very angry about it all, and how important it was that somebody like myself actually really enjoyed working in a multidisciplinary setting, by the way. So I really love working with Dr. Boshovic and others, as you can imagine.
So it's really fascinating to hear how things have evolved and how difficult it was in those days, even to get the very minimal knowledge that somebody would need to run a service. Here we are, several decades on, and you've obviously been witness to the progress that has happened in this field. And a lot, I mean, there is no denying that a lot has been achieved. In this country, we are now able to provide cure for children, although 10 years too late, or 10 years behind the Americans. We are now, from the NHS, being fully funded for undertaking bone marrow transplants for adults as well, which is starting, which was commissioned before the pandemic, but is soon going to start. We now have universal newborn screening, etc. There's a lot out there. And yet some of the things that you've mentioned, about lack of help for the individual parent to kind of support the child, the not knowing, or how pushing children to do PE when perhaps it's not ideal. It is completely endemic even today.
Mm-hmm.
And how does one constantly, what would you advise people in the audience? How does one constantly fight or strive, let's say, towards improving the awareness, improving the knowledge of clinicians? I mean, how does one really break that knowledge darkness barrier?
Well, Subarna, I find myself in a situation of acknowledging, as you have as well, the progress that has been made in the provision of care for sickle cell disease over the last 40 plus years in this country. However, there's a big however. If one looks at some of the tragedies that have occurred with patients with sickle cell disease in the last couple of years, Evan Nathan in North London, before his death was before COVID. I'm very conscious. I know I'm retired, and I'm very conscious and think a lot about all the health professionals coping with COVID and the pressures it's putting on, and how some things are going backwards as a result. I accept that, but when we look at the case of Evan, he died in 2019, ringing from his hospital bed to get oxygen. No, you can't blame COVID on that. No. And then we hear during COVID, yes, of the death of Richard Okereke, whose mother wanted to report him missing to the police, and told the police that he had sickle cell anemia. And what was their response? Well, if you don't know where he is, how do you expect us to know? The fact that she had mentioned that he had sickle cell anemia played no part in, well, you know, how they treated the mother as a human being anyway is. But I give that as an example in the sense that we did have issues in the 70s and 80s with avoidable deaths in police custody of individuals with sickle cell disease. Now, Richards was not in custody, we know, but I'm talking about things have gone backwards in some areas. And then I am aware of a young teenager who has died, whose death has been attributed to some aspects of negligence in the healthcare system, a young person with sickle cell disease. So hearing examples like those makes me question, and particularly going back to Evan's death, why have things gone backwards in certain areas in respect to the provision of care for sickle cell disease? How come when they explored some aspects of why did Evans even have to ring 999, the lack of awareness amongst nurses? I'm focusing on nurses because that's the group that I'm familiar with. And so we know that whilst sickle cell disease got onto the NHS agenda, which it did, and in some areas, as you've highlighted, has really benefited universal newborn screening. I never thought I would see the day when every baby in this country there is the ability for the family to accept newborn screening for that child, regardless of ethnic origin. Because 40 years ago, we were hammering away at sickle cell disease is not only confined to people of color. There are others, you know, et cetera, et cetera. So there have been some quite radical developments that have benefited individuals with the condition. Of course there have. And, you know, when I am complaining and getting angry about areas of neglect or lack of progress, it's not that I'm forgetting what has happened. But I am angry when I see that we are going backwards in some areas, because that tells you that this is not truly embedded on the agenda of the National Health Service. It just wouldn't, these incidents would not, and particularly those within the NHS setting. And the fact that the North London tragedy really had opened up the lack of awareness that there were some, from what I have heard, I may be, that there were qualified nurses who were saying they did not know about sickle cell disease, or they didn't know enough about, you know, come on, in London. So there's no, I get angry because, you know, you can understand if it was a really rare condition that nobody knew much about, but got an, you know, first illness to be recognized as molecular disease. I mean, that should be obviously taught, even from the pure science point of view, never mind the nursing care, etc., both in the hospital and in the community. So what is going on? Well, I am very clear what's going on, and I say it with no hesitation at all. It's an example of institutionalized racism within healthcare. Now, I'm talking in terms of a really large definition of racism. And I'm not saying that those nurses, you know, were, well, I can't prove that there was racism. What I'm saying is, organizationally, how come those nurses were never taught about sickle cell disease? Even if we just focus on that area, then we can argue that that is institutional racism, that is allowed to happen.
I think acknowledging that these deficiencies are there, I think is very much the first step before we you know, I think there's so much happening post-COVID and during this time that I think, you know, this is a very, very, if we don't learn now, if we don't wake up now, I'm not sure we ever will. I think I'm going to now ask Samar to take on, because I'm conscious that the time's gone on.
Well, I think this conversation leads actually very elegantly into the next stage, because what Elizabeth is saying here to me is that, you know, we've got some really difficult things that we need to do, and we can only do them by admitting some uncomfortable truths. And I think if I could, in this next section, and please throw your questions in so that we can address them when I finish this next section of our conversation. I mentioned in the introduction, I've been reading this lovely book, Dreams from My Mother, which Elizabeth has written. And it stops me and makes me think quite a lot along the way. And I want to talk about activism now, and also about individual stories, identity. And that alludes to one of your 3 Ps a little earlier, really. If you don't mind, I just want to read a couple of excerpts. I'll read one, and then we can chat about it, and then I'll read the next one, if that's okay. So this is from the chapter called Paris, when you travel to Paris. And it's when you go to work in a clinic. You stayed with some doctors at the time to help their children with their English. Yeah. So one paragraph: while working at the clinic, I became friends with Paula, a French Beninese midwife. She was so friendly and feisty, and we got on extremely well. It was Paula who would play such a significant role in enabling me to embrace my Black and African identity and a widening political awareness. It started off during a coffee break when she asked for my opinion about who was the better, in quotes, colonial power, France or Britain. I honestly hadn't a clue what she was talking about and admitted it. And as I've been reading your book, this seemed to me one of the little turning points. There've been a few that started you on a particular path of discovery. Could you sort of tell us a little bit about that and how that's informed how you approach making sure that everybody in our communities has all of the information they need to look after themselves and their families?
Yes, thanks. So one of the things that I told Paula was that, just to put it in context, I am the outcome of an affair of a white Irish heritage mother and a Nigerian father, and that their affair took place when they were both students at Cambridge University. They didn't get married. As I've said earlier, I did find my father when I was 25. But as a result of the difficulties for my mother, she decided to drop out of Cambridge University and not go back, even though she could have done. But I was placed in a children's home just for the period that she could sort herself out with another career and get on her feet. And that took 9 years. So for the first 9 years of my life, I lived in a children's home run by Catholic nuns in this country. And I was the only Black child for virtually all the time I was there. And I told Paula about the time that I washed my face 10 times to try and become white like my friends. And Paula said, do you know something? You should read Frantz Fanon's book, Black Skin, White Masks, which I did. And Frantz Fanon was a psychiatrist, a French Caribbean psychiatrist working in Algiers before Algeria got independence. And just to sum it up very briefly, he argued in that particular book of his the influence of colonialism as predominant, well, a white power in terms of France and Algeria, and that when he was working as a psychiatrist in Algiers, he noticed how significant number of brown-skinned, dark-skinned Algerians wished that they could be white and acted out as though they were white, saw their own identity, their brown skin, black skin, as inferior to the white person, and wanted to emulate in all sorts of ways the white person within the higher power structure. And that really helped me understand why, going back to childhood, I had washed my face 10 times. I mean, I did obviously understand as I was growing up why I did it, but reading Frantz Fanon's book really opened up this whole sort of global situation in terms of hierarchy of skin color. That's the only way I can put it. And but then at a personal level, how it had dented my inner confidence so much. But having read that book, how it sorted me out. No, I mean, it really did sort me out in gradually becoming much more proud of who I was, including my skin color. And I've never forgotten both Paula telling me about the book and me reading the book, and how that helped me just go forward in a much, much more confident way. I was still angry because but I've used my anger, I think, in a very positive way in working with people like Dr. Boshovic, etc. And although, you know, anger can be negative against you and others, anger can also be positive for somebody like myself and others if you use the energy of the anger positively.
Yeah, definitely. And it's going on, which is the second excerpt, which relates to, I guess, when you started thinking about finding your father an extended Nigerian family. Again, this is from because I think this was another turning point for me in the book. Again, in the Paris chapter, when you talk about, even though you were working in Paris, you still had this driving ambition to become a health visitor. So you would regularly go back to the UK on your favorite hovercraft to make sure that, you know, you were applying for the right jobs and getting the right sponsorship from health authorities. And a chance encounter, which I find fascinating as it sort of helps us along our own journeys. So here it is. During this time, being in Paris, that is, my ambition to become health visitor never wavered, and I made several trips back to London to ensure my place on a course, as well as sponsorship from an employing authority. The hovercraft was my favourite form of transport across the English Channel. And on one such trip in January 1970, I noticed a black man staring at me. He eventually approached and apologized for bothering me, but wanted to know where I was from. Here we go again, I thought. I like this bit because I can empathize with this bit, because I often have to have this conversation. I thought and trotted out the standard refrain, half Irish, half Nigerian, born in Birmingham, England. He immediately responded, "But there's no such place as Nigeria. Don't you know there's a war on? The Biafra War has been raging from July 1967 and would end in the next week or so, and it had huge coverage around the world. The images of pot-bellied, starving children had sent out shockwaves. Whilst aware of my Nigerian heritage, I had no knowledge of my father, not even his name, and thus felt no personal link to the conflict." This man continued, "You look like an Igbo." I hope I've pronounced that correctly. Igbo.
Yes.
"It's really important that you find out about your father," he said. A stranger, a chance encounter.
Yes. Yeah.
And how does that then, do you feel, your experiences, and we all have individual experiences, allow you to connect or have anger for people that then allows you to, you know, in healthcare, and now I'm talking, to improve services for them? Do you think those two are linked? Are those part?
Well, I think for some people they're linked. I think until more people write their narratives on these issues, I'm not too sure. But certainly I've been very influenced, as you can see from the title of the book, of President Obama's Dreams from My Father. And he also plots his growing awareness of his full identity and the issues facing him when, depending what part of the world he was living in. Of course, he lived in various countries in the world as he was growing up, and he also lost his father at quite a young age. So that's definitely helped me understand, and he had it pointed out to him. So President Obama had it pointed out to him as he recounts in Dreams from My Father, that somebody, he was going for a job as a community activist in Chicago, I think it was, and the person that was interviewing him and gave him the job, but challenged him and said, well, what's a middle-class guy like you doing applying for a job like this? You must have a lot of anger in you. And at that point, Obama had not realized that he had this deep-seated anger, or to do with all this identity and race, etc., and his place in society. And that was a light bulb moment for me as well, that that we may not be aware of why we get angry, why. But he obviously directed his anger as he became president of the United States of America, and it clarified for me how I was. And I say this deliberately. I was fortunate enough, for whatever reason, to use my anger, the energy it created, in a positive way, because it could have gone. It could have just messed me up totally, really could. And I'm sure those of us, you know, a lot of us like reading biographies and autobiographies, and we've seen that in people who have not been able to cope with well, it is a sort of cognitive dissonance, isn't it? It's that you know what you are, but other people don't seem to know, and well, why? And you and it hits you in unexpected ways. And there's no doubt that getting involved with sickle cell campaigns, with people like Dr. Boshovic, but also within sections of the Black community, it enabled you to vent your anger in a way that the authorities, because you were identifying gaps which the authorities really couldn't argue against. And however angrily you were arguing, because I did at times lose my cool, but I was arguing on the basis of facts. That was one thing I had gradually learned from others, just what I used to watch, how others campaigned for other issues. So for example, I think I do mention this in my memoirs, I have been so impressed by watching the history of AIDS activism in the United States and in this country and elsewhere, but particularly in the United States. It gives you sort of ideas of how you can transfer some of those strategies to strategies for sickle cell. So I'll give you one example of where I realized I could use that strategy, which was when I realized that there are actually more cases of sickle cell disease in this country than cystic fibrosis. Now, as I've said, I'm not pitting sickle against cystic. They're both, we know, they're both very serious illnesses. However, when you're with policymakers or politicians or whatever, if you can say to them, "Oh, hold on," I think at that point we used to say there was about the Cystic Fibrosis Society was saying there were about 10,000 cases of 8,000 cases of cystic fibrosis, and we thought there were about 10,000. I mean, the figures have changed a bit now, but still, sickle cell disease, there are more cases of sickle cell disease than cystic fibrosis. Now, cystic fibrosis deserves more resources. There's no doubt about it. However, I saw that there were regional centers, there were cystic fibrosis specialist nurses. Hold on, why can't we have the same model then for sickle cell disease? And there's no doubt those sort of arguments worked, because when you're facing somebody who's had been saying a minute before, well, you know, Elizabeth, it's a minority issue, and you know, we can't do it. So hold on. Why are you saying it's a minority issue when these are the stats for cystic fibrosis, these are the stats for sickle cell disease? And it was clear when I was telling them that they didn't even know those statistics. It was like, gulp, and either try another tack or actually concede, well, I think you've got a case, not just me, but all the campaigning people that were involved. That was such a big learning point for me, a huge learning point for me.
Yeah, so this sort of translation, which is, I think, going back to the title of our event today, how pathology can help reduce health inequalities. Now, pathology and pathologists and the wider team, I include biomedical sciences colleagues, healthcare sciences colleagues, we're a big team. Often, most of us in I don't like the term back room, I don't like it, but I've said it now. We're not seen necessarily by patients, but we see patients a lot. We see a lot of patients through their samples. And we see people, you know, somebody, a title I'll steal from Eric Topol's paper, from pre-womb to tomb. We see people right across. You talked about screening. So we have a big impact on people's lives. So how we therefore we're in a driving seat in terms of being able to help with reducing health inequalities. So how do we do that? What sort of things can we do? You've talked about converting this anger, frustration, shame you felt when you learned about your lack of education, how you convert that into action with data. What other sort of roles do you do?
There's many other ways that I realized. It obviously, I used to say I had a foot in the community, even though I was employed by the NHS, I had a foot in the community and I had a foot in the NHS. They didn't pay me for the community work, but I knew that without the community activism, you couldn't improve what was happening within the NHS. So it's the ability to not be scared of stepping into arenas that maybe the organization, the culture deems, well, I'm not sure that's really what you should be doing. But actually, you've got to just be clever enough to demonstrate why it's important to be involved with. I don't think it's such an issue now, but you know, in the 70s, it was, you know, nurses were supposed to do this and doctors were supposed to, and you know, community, we were supposed to tell the community what they needed, not dare ask them, you know, or when they challenged us, which they did, you know, they certainly did. I mean, remember this was the 70s and the 80s, and you know, we have the Black Lives Matter today. We had the equivalent of Black Lives Matter. It wasn't called that at all, but it was the follow-on from the overlap of the civil rights era in Britain. And thankfully, on the media, our media here, we are now learning more of the Black history of the 70s, of the 80s in this country. Some people have told me, how come we didn't know about the mangrove? You know, they didn't know about it until Steve, somebody's my thank you. Oops. So in that sense, media portrayal of the Black British experience has definitely improved, is improving. So yeah, I think I hope that, sorry, does that address I've gone off on one.
Yeah. No.
Sorry, I've got a problem with one of my phones. I do apologize. I can't stop it ringing. When it rings, well, it's not like you can hear. I just I've taken the batteries out and everything, but so my apologies.
That's okay. That's
Hearing
okay.
you.
So I think I've got a few questions. I'm sure Subarna's got some more questions. But please, for the audience, if you have any questions, comments that you'd like to address in this next part of our event, we'll take some of your questions, observations, comments, ideas about how pathology can work
I'll just see if I can stop this
towards improving health inequalities in the UK. Subarna, I've talked a lot. Did you want to have you got any questions you'd like to follow up on? And then I can keep an eye on question answers.
I would, yes, thank you, Samar. Before we went on air, as it were, we had an interesting conversation backstage. And the first thing that Dame Elizabeth asked Samar and myself was that, we're obviously in a Black History Month event. Where are the Black pathologists? Where are the African heritage pathologists in the college? And she asked us what was the percentage of Black pathologists in the UK. And from the work that I've been involved with the college's EDI group, I know that we have, at the moment, we are unable to actually give a number. We don't really know how many pathologists who are part of the college actually identify as of being of Black heritage. So I think, I suppose it's a comment really, and it'd be interesting to see what the audience in this program today feel about it. But I think information, I think we probably ought to have that kind of basic information about about the kind of diversity that we enjoy within our membership. And also that obviously that would help us reflect the diversity that our patients enjoy as well. And this is, so I think it's a very simple question, but I obviously didn't have an answer for that.
And also I think, again, reading your story, Elizabeth, of how you lived a substantial part of your life in a white environment, and then through a number of different meetings and encounters, you learnt more about your own identity and heritage. Does that give you a view on how best we can tackle some of these difficult conversations? Do you know what I mean? In terms of, well, the very difficult questions you raised about deaths of people with sickle cell that should have been really avoided, or the interaction of the mother with the police when it came to her missing son who had sickle cell. I remember this at the time, which is about racism, which is very difficult, I think. So do you think that your very sort of rich life gives you a way of being able to discuss some of these things more readily, and that we can learn from?
Well, I think first of all, having grown up, as you said, in a mainly white society until I was a student nurse, in fact, and yet, yeah, being in a brown-black skin, well, brown skin, you then have to ask, how does a white person attempt to get into the shoes of an individual who has a skin color that society, and when I say society, I'm not talking about every individual, but I'm talking about society, views as inferior to the white skin? If there's an acknowledgement of that, because whilst some people do acknowledge that, there's an awful lot of people who still really don't acknowledge that. There's a feeling that race is being used in a negative way to attack people white people who feel that they've never done anything wrong. It's not their fault what happened historically. They don't have the power to change this or that, who get very upset when the term white privilege is used as an example of and I know this term intersectionality is now, I'd never heard of it until, last few years, but it is useful to see that we are all capable of just living in a box or a couple of boxes, or and not be able to really understand the lived experiences of those who are in the boxes that don't affect us. So, so we all know the various aspects of class, gender, sexuality, religion, age, etc., etc., etc. But those, so it's the, how can you get the society to help those individuals who are not Black in the broader definition of Black to understand that this is not necessarily a personal attack on them, but they do have to accept. They do, if they don't accept that there's racism in the country, they're never going to accept that they could actually be affected subtly or overtly or covertly by living in a racist society, growing up in a racist society, working in a racist society where you're not even aware of the issues that are facing brown, Black-skinned individuals. If you take it as a personal affront every time racism is discussed, racism is still going to wield power over that. So it's a very, I have to be honest, I don't think racism will ever go away. I think that there's something about individuals wishing to feel superior to others, and there's all sorts of categories in terms of how we can feel superior to others, whether it's our class, our educational background, or our family background, etc. But when you come to feeling superior to people because of their skin color, I can't get rid of my skin color. I don't want to get rid of my skin color. I did when I was a child. And I think that tells you something, that we're left, we have this permanent, it is a stigma. And it's interesting that I didn't learn this until a few years into being involved with sickle and thalassemia. I didn't realize that thalassemia, Chakravorty, you may correct me on this, but I think thalassemia does mean it's sort of a stigma of the blood. It's seen as a sort of stigma. And that's something internal, that is. So every time somebody sees you, and this is what dawned on me when I got a little bit older, and I think it unfortunately affects, children at a much younger age now, the awareness that every time somebody sees me, possibly the first thing they will notice is my skin color. And we do not know then what else will happen, subtly or not so subtly, as a result of that person seeing you walk into a room and seeing your skin color. And we have to live that. We have to live with that for the whole of our lives. And nobody knows, even though they may think, well, you're in a better situation now. For example, because, well, Elizabeth, you're a dame now, you are, you've really achieved, and some people have actually come out with it, but others, I think they're thinking it. I might be paranoid, but I don't think so. What are you going on about racism for? You've done all right. So I think that is that. So although I'm pessimistic about the fact that racism may never go away, what I'm more optimistic about is if people had the courage within their profession, within their organizations, to actually call out racism when they either see it personally or when it is referred to them from an ally or somebody who has witnessed it and has had the courage to call this out, or whether the individual subjected to what they feel is a racist experience, for the organization or for the individual to listen to what that person is saying, look at the facts, and have the courage to do something about it if they feel the evidence is there. Because that is just not happening enough at this point in time.
Yes. We've got a couple of questions just come through. So I'll go to the audience and then can follow up with some of that. So we have a question from Laura Setio. Again, hopefully I've pronounced that correctly. How can we as pathologists become more involved with the college's EDI work if it's possible? Well, we can answer that, shall we? Do you want to, Subarna, tell Laura about the diversity network, or? Yeah.
Yes, I mean, Samar and I are both, I've met Samar for the first time through the diversity network. It is truly a diverse network, not just on diversity on the basis of the color of your skin, but also through, you know, all the protected characteristics that that we have in this society. And actually, it's really, I mean, you know, it really is quite eye-opening to see the kind of how much diversity this college enjoys in its membership. So I think it's an open, I think there are ways to join. Esther Yaud, that Samar mentioned earlier, she's the assistant registrar of the college, isn't she? And you can contact her directly. She's on Twitter as well. I don't think she's here today, but what we could do is we could ask our CPATH college team to actually just put the contact details of Esther in here in the chat box, and then maybe you could just simply write to her and say that you're interested in it. There is a sort of tenure of the membership, and I think she's pretty open to have as many people in that group as possible. And we meet once a month, don't we, Samar? And it's all on Zoom, so it has really helped. One thing that has helped improve diversity, you know, through the pandemic, has been the access to Zoom, because there's lots of representation from, you know, from places which are quite far from London. And we were discussing that, you know, if you were a pathologist with a caring responsibility, you'd never be able to be part of this group if you had to actually travel to London every time there was a meeting. So I think that's a pretty easy thing to do. We'll just contact Esther and she'll let you. There we go. Esther.yod@glasgow.ac.uk.
There we go.
Oh, she's here. Hello, Esther.
She's here. Hello, Esther.
Is there anything else? Oh no, Esther can't speak because she's not
No.
backstage. So there we go. And there was another question about from Alexandra Yates, and she says, I was disappointed that the college didn't return any MRes and would love to hear how the college are addressing the fact that they didn't have this data. I'm afraid Samar and I will not be able to answer this question, will we, Samar?
No, I think we're looking at beginning to collect the data again, from my understanding, and that's something that the diversity network and colleagues on that have taken a lead on. So hopefully this will change, because clearly it's really important, as we were discussing with Elizabeth earlier, because, you know, how do we know otherwise, and how do we understand how to improve recruitment, not just into pathology, but probably into medical school in the first place, with outreach and so on. Okay. So I think we were going to have a sort of summing up. So if I've jotted some notes, I'm going to sum up a few things. Subarna, if you'd like to follow with some of the thoughts you've had, because I'd like to sort of try and work out where and what pathology can do to improve or reduce health inequalities, rather than just have an event. I'd like for us to take this to the next step and try and learn about how we can do that. Just listening today about the story of sickle cell disease, about the people affected by it, about the stories that Elizabeth told us about families, and about her reflections that really I should have been taught about this and I wasn't. And as you were talking about, why wasn't I taught about this? It suddenly struck me, well, are we teaching undergraduate medics enough pathology? And I know that the answer is no, because certainly since I was at medical school, pathology within the undergraduate curriculum is less. And we can have another whole session on that, but we won't. So education, I think, is really important of the professionals, but also Elizabeth's conversation led me to think about engagement, and the college does, I think, some really good public engagement work. And I think this is where we engage with our communities and work on how we can help better understanding of disease, treatment, and not just disease, but maintaining health. I think we can contribute to that. Research we didn't really touch on, but I think pathology is involved in research. It might be clinical trials. And I think having a thread that always runs through this, are we engaging with everybody? Elizabeth talked about her interest in genetics and counselling. Are we engaging with everybody? Are all the subjects of research, projects and trials truly representative? That's something I think pathology can help with. And then the other two things are advocacy and activism. And certainly from what I've learned from Elizabeth today, I think you made a comment about when you discovered there wasn't somebody who could engage with the community about sickle cell and about the mentors and allies that you met with. And you said, look, I have a role here. And I think that's really important, where we look at ourselves and say, we might not meet all of our patients. Some of us do, some of us don't. But we all nevertheless have a role here. And I think that's what I've picked out from today. And not to be scared to venturing into different arenas. So moving beyond and outside of pathology. Subarna, do you have any sort of reflections?
Yes, I mean, just speaking to Dame Elizabeth is just so inspiring. I mean, the energy that you exude, Elizabeth, is just, it's really amazing. And, to have that kind of drive is just, I guess there's not very, the people like you will shine the light, will lead us, but then we all have our roles to play. I think we all have, and particularly during the pandemic, I mean, pathology has played an enormous part, if you think of the diagnostics, if you think of, the amount of work that our virology colleagues have had to do over the pandemic. And I'm just staggered by not just the medical virologists, but also the laboratory scientists that have and the geneticists, and all this variant, the variants that have been constantly having to be surveilled, and I think there is a lot to, we have seen through pathology the effect that this pandemic has caused our patients. We have seen the direct effect of inequalities, and we, even now, only just 2 weeks ago there was a paper in the BMJ where they've shown that compared, even for doubly vaccinated individuals. So they had a group of people, there was a very, very large study with about nearly 7 million GP registered patients. It was a GP database. And they found that the doubly vaccinated people, the deaths among the doubly vaccinated people, even in those groups, there is an inequality based on race. So there would, compared to the white male, there would be, much higher risk if you were a Pakistani male, for instance. And actually, some of us, were very shocked to hear that if you were sickle cell disease, and I'm not saying that inequality, just the disease itself gives you a very, very high risk of dying, just, even if you're fully vaccinated. It's very small numbers, of course, we're talking, only of hundreds rather than the thousands we've had without the vaccinated, in the non-vaccinated groups. So I think we are in the middle as pathologists. We're really in the middle. We are in the kind of ringside seat of inequalities and during the COVID-19 pandemic. And I think we all kind of owe it to ourselves to kind of really think deep inside ourselves to how can we address, how can we do, what do we do, what can we do? And it's to address some of these inequalities. And in my mind, I don't know, maybe have an interest, maybe just show an interest in something that you've never, you know, as Samar has mentioned before, that kind of get yourself out there and kind of find things that one can do as a, you know, proactively rather than sort of not, as a role to understand diseases. I mean, certainly in sickle cell disease, we have a real dearth in expertise. You know, okay, a lot of expertise is in London, but both expertise and the non-expert education, I think, is lacking. But even if we look at expert education, I think there's a lot that can be done. And if everyone kind of just ponders about that, I think that's something that we can take away from here.
Hmm. And Elizabeth, having listened to us, you know, pick out some of our take-home messages, what would your advice be to pathology, given that we see people, you know, from pre-womb to tomb, as you say, we can screen before people are born, and we can help to explain people's deaths. Mm-hmm. So where can we help?
Well, I think there's the individual level, there's the professional level, and there's the sort of national level. But listen, you have to sort out getting your ethnic origin data sorted out, like yesterday, because as you've just so eloquently shown, it's pathology itself that demonstrated the health inequalities in respect of the COVID pandemic. I mean, you know, and who are doing all this work again that and this might sound really rude, but it's to get your own house in order. And you know, sorry, but that's because you can argue why it's absolutely necessary, and as well as accepting that some people will not wish to disclose. Of course, it's a bit like COVID. Seriously, the vaccination. You can put all the information out there. Some people, for various reasons, would choose not to. That's their choice, as far as I'm concerned. Mm-hmm. But you know, so I think have courage to sort of get that aspect of something that you seem to want, but there's been a few hiccups. And I think also in your ability to give lectures, to write papers, all the skills that you have. You don't have to get new skills. You've got the expertise. It's where do you use that? And is it linking in with like-minded groups in other professional associations? Is it, and plus, it's not either or, where are the links with certain groups in society that would be very pleased to link up with you and to share their areas of expertise? I mean, you're doing that obviously now, but at a sort of bigger level, and that it's going on throughout the year. You know, we know Black History is not just for a month,
for the month,
all the way through. So it's how can you continue this stream of activity, of interest throughout the year, in all the different formats. And again, as Subarna mentioned, what an opportunity with the online presence that is still going on because of COVID. Mm. So make use of that, build up on that, and be courageous in saying, look, we think we have a deficit here. We know our strengths are here, but we've also feel that we've got weaknesses or gaps or whatever you want to call it here. It doesn't, you know, just be open about it. It's not don't be anxious about it. Mm. So share some of these areas that you have concerns about all throughout the year. Link with And you will have links with some of these organizations, I'm sure, just from your own personal, but, you know, for example, I don't know what links you have with, I'm just giving you one example because I happen to know of it, because I've got a few relatives that are members of it, the Nigerian Medical Association that there is. And we know that there often may be country-linked, heritage-linked associations. What about linking? You may well be linking in, as I think you've given an example, Subarna, but there are several. So I think it's just having the pride and courage of your anti-racist convictions, you know, just go with them. You're stronger than, you know, maybe you think you are in pursuing those areas to improve not only for your members and recruit even more, but as you said, for the delivery of the services that you are already doing. You're engaged in many areas that overly impact on minority ethnic communities. So for example, the Sickle Cell Society UK, Subarna, you may know, but what links do you have with John James, OBE, the chief executive of that organization? I just give you that just as one example in areas that you might wish to link in with. So all the other conditions that you all deal with, my goodness, you know, I just think there's so many opportunities because there are people out there who would really wish to engage with yourselves.
Yeah. No, I think the college has been quite energetic around some of those areas that you've talked about. I think there are the diversity network is going to be continuing to be important to strengthen some of those deficits. I think courageous about your deficits is a really nice way of putting it, actually. So I think that's what I gained from the diversity network. I think the college's international links are a real strength, and we have colleagues who represent different, because obviously we have fellows of the college that aren't based in the UK, they're abroad, so we have those links, and again it's about thinking where we could strengthen those, and also, as I was saying right at the beginning, the public engagement that I got involved with a little while ago at the college, I think is really important because it raises people's expectations. So I've done a few things going to schools, you know, maybe, you know, people like to call them underperforming, you know, but I don't like that term, but it's about raising people's expectations and letting people know about pathology. So I think the college is active in a number of those areas that you're talking about. And I think the diversity network will hopefully help strengthen some of those things and you know, being courageous about our deficits, calling racism out, you know, being anti-racist. I think those are all important things that we need to do actively rather than just talk about and make a training program.
And I have one more. I have one further suggestion. Well, you may be doing it already, so I shouldn't assume that you're not doing it. Are you rewarding people who are active in the area of addressing racism and in the anti-racism? Is there a prize or a fellowship? I don't know what you give when you give prizes. I don't know. I have no idea. But I leave that to you. But is it something that people can work towards who know as members of your organization? You've got this prize, you've got that prize, you've got this, you know, have you got anything that rewards people who are really working on this area? You know?
That's a really good point. The answer is I don't know. I probably think we don't, but I may be wrong, Subarna. But that's a really, it's a really important thing, actually, rewarding people. I've just seen, did you want to address the question has come through, Subarna? Did you want me to do it, or
I can read it out. Yeah, so Rachel Wilmot has asked, following on from what we do to get our own house in order, we could also stop setting exam questions that uses the background of the patient to lead assumptions. I think that's such an important point. I'm sure we can all influence that, definitely, by being part of the, be examiners, be part of the exam setting groups, and challenge those questions. I think that's a very, very good point that Rachel's just made, that we stereotype, don't we? We and that really has to change. That really has to change. I don't know if Elizabeth knows about this, but there are some real kind of, the young people gives us a lot of hope. There is a young Black doctor who's set up an organization called Melanin Medics.
Oh yes, yes.
You know about that one.
Yes,
and then there is this, there are sort of black skin skin diseases.
Yes.
People are doing very, very interesting things in pathology, and I think there is a lot of hope in the new generation. And I think these are real role models, young people that have come up with these amazing things. And I think for us who are not so young anymore, I think there is a lot of inspiration to have, both from people like yourselves who have led the way, and people like young people like we've discussed. So there is a lot to learn from either ways, really.
You're not that old, Subarna. I can assure you, you are not.
We've just had a comment as well from Anghara Davis, a pathologist, who says the college's international departments, which I mentioned earlier, is involved in and supports the ARISE project, which is the acronym for African Research and Innovative Initiative for Sickle Cell Education. So I think maybe we need to have something on our website that collates these activities so that we can demonstrate them, because Subarna was saying people are doing important things and really positive things as well. Thank you, Anghara, for that. Okay, I think we're coming to the end of our time. Thank you. Oh, hang on. I've got just another question has just come through. No, I'm done. Sorry, that's me. Yes, so coming to the end of our time, I just wanted to thank Elizabeth so much. It's been really lovely to talk to you, even though it's remote. We'd love to have a face-to-face coffee with you one day when we can. Thank you so much for giving us your time this evening to discuss this. We've got a number of pointers, a number of interesting ideas, I think, to be taking forward through the diversity network. Thank you, and I'm not advertising, I'm not being paid for this. You should, if you haven't, please read it. It's great. And I didn't even get to politics versus activism. Maybe that could be another time. And it's got a wonderful set of references to books that are really interesting to read, to get a much broader perspective and education. So thank you for doing this as well. Subarna, I'll leave the last words to you before we all say goodbye.
Thank you. I can only just thank everyone. Thank you for Esther for being such a great leader for our diversity group. And this should go beyond the diversity group. I think it's good to have more people engaged with this work. And what can I say? Thank you, Elizabeth. Thank you for making such an interesting participant in this event. Thank you very much.
Well, thank you for inviting me. I've thoroughly enjoyed it. Thank you.
Thank you.